Today we'll examine the impact, effectiveness, and future implications of the Affordable Care Act. I'm Greg Lake, and this presentation will provide a balanced critique of the ACA's achievements, challenges, and the ongoing need for reform in the evolving healthcare landscape. The ACA, enacted in 2010, had three primary goals: to expand access to health insurance, improve the quality of care, and reduce healthcare costs. To achieve these goals, the ACA introduced some key components. Medicare expansion, which expanded eligibility to individuals earning up to 138% of the federal poverty level, provided coverage for millions. Health insurance exchanges, which created online marketplaces offering subsidized plans for low and middle income individuals. Another was the individual mandate, which initially required most Americans to have insurance, stabilizing premiums by balancing risk pools. There was also the essential health benefits, which mandated comprehensive coverage, including preventive care, mental health services, and prescription drugs. By addressing affordability, accessibility, and quality, the ACA has significantly shaped the U.S. healthcare system, though challenges like state Medicaid disparities and cost control remain. The ACA was created to address rising uninsured rates, escalating healthcare costs, and inefficiencies in care delivery. Building on earlier efforts like Clinton's healthcare proposals and the Medicare Modernization Act, the ACA introduced transformative reforms. They included the medical expansion, health insurance marketplaces, and also consumer protections, which banned denial of coverage for pre-existing conditions and eliminated lifetime coverage costs. These reforms significantly improved access and affordability, reshaping the U.S. healthcare system. The ACA significantly reduced the uninsured rates from 16% in 2010 to 8% in 2022 through Medicaid expansion and insurance marketplaces. It also improved health outcomes by increasing preventative care use and enhancing chronic disease management. However, challenges remain, including rising premiums, out-of-pocket costs, and persistent disparities in access, particularly among marginalized groups. While not without its flaws, the ACA has been a major step towards broader healthcare coverage and improved outcomes. The ACA was funded through taxes on high-income earners, fees on insurers, and Medicare Advantage cuts. It also helped slow national health spending growth by promoting value-based care and preventative services. However, sustainability challenges remain, including the repeal of the individual mandate penalty and concerns over long-term costs of Medicare expansion. While the ACA made strides in funding and cost control, its financial future continues to spark debate. The ACA improved access to care by expanding Medicaid for low-income populations and mandating essential health benefits like preventative care and mental health services. However, barriers to equity remain, including geographic disparities, language barriers, and low health literacy, which limit access for marginalized groups. While progress has been made, addressing these challenges is essential for equitable health care. The ACA reduced uninsured rates among Black and Hispanic populations through Medicaid expansion and improved access to preventative services. However, challenges persist, particularly in non-expansion states where many remain uninsured. Cultural and systemic biases within the healthcare system also continue to hinder equitable care for marginalized groups. While progress has been made, further efforts are needed to address these disparities. The ACA expanded APN roles, especially in primary care in underserved areas, addressing provider shortages. APNs are vital for preventative care, chronic disease management, and improving patient outcomes. Under value-based care models, APNs excel in delivering cost-effective, holistic care with enhanced reimbursement for preventative services. They are central to achieving the ACA's goals of improved access, quality, and patient-centered care. The ACA requires healthcare administrators to adapt to new regulations, ensuring compliance with quality reporting and value-based reimbursement. Data analytics is essential for tracking performance and improving outcomes. Organizationally, administrators have driven the adoption of patient-centered medical homes and accountable care organizations, emphasizing interdisciplinary collaboration to provide coordinated, cost-effective care. These efforts align with the ACA's goals of improving quality and accessibility. While the ACA has made significant progress, challenges remain, including rising healthcare costs, political opposition, and persistent access disparities. Proposals for reform include introducing a public option or Medicare for all to expand coverage, enhancing subsidies for affordability, and streamlining regulations to reduce administrative burdens. The ACA set the stage, but ongoing reforms are needed to ensure a more accessible, affordable, and equitable healthcare system. Future reforms must address rising costs of pharmaceuticals and hospital care while prioritizing social determinants of health and equity to improve outcomes. For long-term sustainability, policies should focus on stabilizing funding, maintaining Medicaid expansion, and promoting cost-effective care models to ensure the ACA's viability in a changing healthcare landscape. The ACA has improved access and reduced uninsured rate, but continues to face challenges with affordability and equity. APNs and healthcare administrators play critical roles in driving reforms through patient-centered care and resource management. Looking ahead, ongoing reforms are needed to address the systemic barriers and rising costs. With potential changes under the Trump administration, the future of the ACA will depend on balancing affordability, equity, and quality to meet evolving healthcare needs.